Good morning and welcome to the 2013 FormFast User Group Meeting. I'm Aaron Vaught, Director of Marketing here at FormFast, and I'll be your host. Thank you for taking the time to join us today. We have a lot of exciting information to share with you, including new products, new features, a lot of education on how to use FormFast products to their fullest. But before we start the event, I'd like to review how to use the WebEx interface as well as the agenda for the user group meeting. First, note that the audio for the event will be broadcast through your computer speakers. If you're having issues hearing the audio, you can dial into the teleconference. Simply contact me, the host, in the chat window. I'll preview you to join the teleconference, which you can join by going to Communicate, Join Teleconference at the top of the WebEx interface. Likewise, if you are one of our featured speakers and are having issues with audio, contact me via the chat window. One final note on audio, please mute your computer speakers if you dial into the teleconference, otherwise you might hear an echo. Next, feel free to send questions or comments to the chat window or Q&A panel on the right side of the screen at any point during the event. We'll save the questions until the end of the presentation and ask the speaker your question at that time. Now let's take a look at the agenda for the user group meeting. As you know, we're dividing the event into 2 days. Day 1 is today from 11 to 2 Central. Day 2 is tomorrow from 11 to 2 Central as well. Today's session will kick off with a keynote address from our CEO, Rob Harding, momentarily. His address will be followed by a product showcase section led by VP of Product Management, Scott Fuller. You'll see some brand new features for products you might already own, as well as getting a sneak peek of new functionality and development that we're excited about. At 12:15 Central, we'll feature a couple of FormFast users sharing how they're utilizing FormFast to improve processes, describing the efficiency challenges they've faced, and outlining ways they've overcome them. So definitely stick around for that. Finally, today at 1 Central, we're featuring 2 breakout sessions virtually for you to choose from. We want to put as much valuable content into this event as possible while still being respectful of your time. So the virtual breakout sessions allow you to decide what portion is of most interest to you. How this works is at the conclusion of our main event today, you'll be presented with a selection screen. Click a button to be launched into the session of your choosing. Today we have 2 to choose from. The first session is a brief tour of our new user group site. This is something we've been working on for a while, and we're excited to show you some of the new features we've built in to help you use FormFast products better. The other option is what we're calling an ISIS, Interactive Solution Improvement Session. This is a chance for you to help shape the future direction of FormFast products. VP of Product Management, Scott Fuller, will lead this conversation and is looking forward to hearing your feedback on ways we can improve our product line. Quickly looking at day 2, we'll be providing a lot of FormFast user information tomorrow, including success strategies, product education, and conversation between FormFast users. We'll start today with an automation case study featuring a team from Phelps County Regional. At 11:30, we'll dive into our FormFast user panel discussion. This will be a great chance for users to share best practices for implementing FormFast to discuss healthcare challenges and any number of other relevant topics. If you'd like to represent your organization and join tomorrow's panel discussion, there's still time. Send me a message via chat and I'll contact you this afternoon about joining. At 12:40 tomorrow, we'll hear from Kim Kaur at Chatham-Kent Hospital about how they are improving operational efficiency and reducing costs. And then finally, at the end of day 2, we'll be having another round of virtual breakout sessions. Tomorrow will be all about education. We'll have tips and tricks for each of the products, plus demos if there is a new product that you want to learn more about. Make sure to come with questions, as you'll get to talk with a FormFast consultant about ways to improve the way you use FormFast. Of course, I'd be remiss if I didn't mention our giveaway. Before the breakout session today and tomorrow, we'll do a drawing for an iPad mini for those that have registered for the session. So stick around to find out if you win. And finally, since there are so many FormFast users spread across North America and the rest of the world, we understand it's difficult to get everyone in a single physical location. So that's why we're hosting this event virtually. But hopefully it will be an interactive event. Once again, we encourage you to use the Q&A and chat windows to share your feedback. We'll also be conducting polls throughout the event, and we'll be hosting the ISIS session I mentioned during today's breakout portion. There's also the user forum panel that you can participate in tomorrow. Plus, we've allotted plenty of time for questions during the tips and tricks and product demo sections tomorrow as well. And now that I've got the housekeeping items out of the way, we'd like to kick off the meeting with a word from our President and CEO, Rob Harding. Since founding FormFast over 20 years ago, Rob has led the company to be the dominant provider of forms automation for hospitals and has set a vision for FormFast to continue to develop new innovative solutions for improving healthcare processes, some of which you'll see today. And Rob, at this time, I'd like to turn the meeting over to you.
Thank you, Aaron, and good morning to all of you. First, my thanks for your support of FormFast, and particularly for taking time out of your extremely busy schedules today. Some of you have been customers for most of the 21 years we've been in business, and many are brand new to us, to the FormFast family of customers, and I welcome all of you. It's our sincere intent to make this time productive for you. There's been a tremendous effort to address the issues that are most important to you, and we'll look for your feedback on how we did. State of the market, paperless, a relative term. As always, when trying to position FormFast, you as customers, we as a vendor confront the common sets of goals and challenges. There's a lot of conjecture about hospitals becoming completely paperless. We don't deny that can happen and has happened. However, the cost and effort to do this across the enterprise is far more than most hospitals need or want to invest. We received a study of an 18-hospital system that converted to Epic with excellent results. All were happy. However, 1/3 of the 6,000 paper forms were still in use after an Epic go-live, so that's 2,000 forms. For most of you, based on any reasonable cost justification of automation investment, a need for some level of print-on-demand will continue across all levels of meaningful use. Another document automation product that completes the EMR is electronic signature, which is used for consent forms, for discharge packets, and patient education forms. These may be either tethered or used on a mobile app such as an iPad. We're installing these types of systems at hundreds of customers, be they Epic, Meditech, McKesson, Cerner, or others. Our workflow and our new content management solutions take you to the next level as the front runners in paperless automation and such things as HR, contract management, payment automation, or really any application you wish to build on this fast flow workflow platform. Now, with our new content management platform released in January, we now meet your needs for those of you who do not have a content repository available to support workflow. Our value proposition in brief is that it's not practical for any but the largest hospitals to purchase and implement best-of-breed applications. The computing environment continues to grow more complex due to changing technology and security requirements. We propose to offer a suite which will allow you to build many of these best-of-breed applications from one source. So, in our corporate positioning, we look to growth. FormFast continues to grow market share as the legal and technical requirements to be a competitor in our business become ever more challenging. We have no choice but to grow because overhead of compliance grows geometrically. We now serve over 1,200 hospitals, many more if you count facilities rather than systems. Some of the new clients in the last year are IASIS, Christus, HMA. We've added 25 new Dignity hospitals to our existing contracts there. But it's not all about large IDNs. We've added 50 to 60 community hospitals. These are 50 to 100 bed hospitals, such as Broadlawn, which is a Meditech Meaningful Use Stage 7 entity. We've brought some new things to our friends at Phelps Memorial in Rolla. where they recently completed a rollout of our workflow suite called FastFlow. Another long-term FastFlow user is the American Hospital in Dubai. They use all of our product suite, but they're notable for use of our workflow product for catering orders for their many executive and royal family clients. This, we never know what the product might get used for, so, it's all about flexibility. So, and while we've had installations outside of the U.S. for years with maybe 150 clients in Canada, quite a few in the U.K., and, Dubai, as I just mentioned, this year marked the opening of our international subsidiary, FormFast Global Limited. So we're very excited about that. They're based in Nottingham in the UK, and we'll manage our activity from there for the Middle East, South Africa, Europe, Singapore, and Australia. So growth is about a number of areas for people. To support our growth, we've increased our staff by 50% to staff our help desk, our project management, our product management functions, and we have created a fully staffed account management department so that existing customers, have a representative who is not there to sell them something, but to make sure that we're aware of your needs and that you're aware of what solutions we have. As our advisors tell us about healthcare in general, there are many more small niche companies than the market can support. There are relatively few choices on the high end of the market, for the size of healthcare, of hospitals, and there are not a lot of entities in the middle. So the prognostication is that many of these smaller companies will be eaten in the coming years because you, our customers, don't have the overhead and staff to support that many vendors, each with sign-on and security issues, database requirements, reporting and dashboard communication environments, the need for someone on your staff to support and communicate with that vendor is just not there. So, FormFast's plan is to acquire other companies or to continue to increase our staff as it makes sense to meet your growing needs. We intend to acquire many new customers from competitors with smaller market share who cannot realistically keep up with the compliance and development environment that you are now requiring. Culture. The question is, what else can you expect from FormFast that you may not have seen in the past? Our surveys show that when you come to us with a problem, we do, on average, respond effectively. I absolutely know, however, that at times we've not met your expectations. Why? This is due for a need for better systems, better processes, and better training at FormFast, which will improve our performance. Our marketing message is, let us help you become a high-performance hospital. By the same token, you deserve a high-performance vendor. With that in mind, we have made large investments in communication technology and training and people to prepare ourselves for the growth which must inevitably happen. Our culture is very different than 2 years before. Today, we're working to create mutually acceptable, clear expectations for the roles of each player, both the vendor and customer, and to complete and document all of our obligations. Today and tomorrow, you'll hear from some of our customers, and I thank them for helping you all to see how they approach some problems that most hospitals share. We'll hear from Alberta Health Services, Phelps Regional in Rolla, Rideout Health in California, Chatham Kin in Ontario, and between them, you'll hear some feedback on success and experience across our product platform. So, in conclusion, there have been some surprises. I would have been surprised if you told me 2 to 3 years ago that our most popular products would be electronic signature for consents and discharges, that large sellers would be invoice and payment automation, workflow systems. Today, that's the case. Who knew? I would have been surprised if I heard that our traditional print-on-demand products line would continue to be a growing sector of our business. I did not expect that, but it is continuing to be a growing sector of the business. I expected that we would release a sophisticated non-clinical content management repository, which we would build to support our workflow suite. What I didn't expect is that the release would go quickly enough for a first quarter 2013 release, and I didn't expect that the interest in this platform would be as overwhelming as it's turned out to be. So we'll be talking more about that. We do find that the solutions available to hospitals from larger enterprise software companies have a lot of gaps or holes in functionality. That's absolutely not surprising, and that's absolutely not bad. You are a very complex environment. But the question that I know all of you are working on, worrying about on a daily basis, is how to plug those things. How do you plug, do you plug each hole with a different solution, with glue here, with plywood there, with a new wall or a window, or you just put up with the draft? You often need a contractor or a supplier who can manage many of the diverse requirements you have. And in our realm of workflow with a document-centric focus for both paper and paperless documents, we feel that FormFast has a lot to offer you. So we'll be talking to you more today, and thank you, and back to Aaron.
Thanks, Rob. As Rob mentioned, there's a lot of exciting developments happening here at FormFast. So now to tell you about some of the updates to our product line, I'm joined by VP of Product Management, Scott Fuller, and members of his team. Once again, if you have questions for Scott, send those questions to the Q&A window, and I'll present them at the conclusion of his presentation. And Scott, the floor is yours.
Okay, thank you, Aaron, and thank you, Rob. Appreciate everyone's time this morning, and we have with me here, you'll hear from them shortly, both Cliff Babbitt and Ben Smith. They will be showing aspects of some of the things that we're working on. Some of it is technology that isn't released already, and some of it's technology that's right around the corner. We want to show you what we're working on. We have a lot of very exciting things going on with our entire pipeline. As Rob had mentioned, we are international now, so we're looking at just the different international implications of how our products might fit in different markets. Likewise, here in the United States, where currently a lion's share of our customers reside, there's a lot of wish list that we are now getting off the wish list and actually making product features. And we have a lot going on with our entire product line, but in interests of time this morning, I'm going to focus on some of our relatively newest and in some ways our hottest products, like Signature, FastFlow, and Content Management. We have in Electronic Signature a very successful release of this thing of it's now available on a mobile platform. We'll be showing you what that looks like here shortly. Cliff Babbitt will be demonstrating how that looks and how the Signature interoperates on a tablet device. I believe it'll be an iPad device he'll be showing you the screen of. And we have just a tremendous amount of tablet technology that's coming into the healthcare arena, and we want to be on the leading edge of that as hospitals are looking at the technology for other applications. It makes sense for us to also offer functionality on those devices, not just with electronic signature, but in the future with both our content management system as well as our workflow platform. We want to take advantage of the fact that someone may have a tablet on the network and to allow that flexibility to interoperate with products as it makes sense and as it can enhance the patient's experience in the hospital. And again, this particular feature, Cliff Babbitt will be showing this very shortly. In our workflow product, what we're going to show you here in a little bit, is our visual route designer. Historically, we've always been able to create how a workflow flows, within an organization with a very easy-to-use wizard. We generally get a lot of compliments on how it looks and how easy it is. We've decided to make that even easier now with the ability to visually design the route and add attributes to each step. And Ben Smith, our development staff, the author of the code, if you will, to make this functionality happen, will be showing this feature as well shortly. And it's just the beginning of some very exciting changes that we have coming to our workflow product. This is just a small sample of a much greater scope of things that we're going to do to this product to make it even more robust, to make it even more friendly, and again, to listen to our customers as to what they're wanting to see from a state-of-the-art workflow product in healthcare. And then finally this morning, Smith will also be showing some of our latest enhancements, our content management solution, redaction, the ability to block out areas of documents is a feature that we're going to be releasing here very shortly, so you're going to get a little glimpse behind the release curtain, seeing what's coming up, as well as a lot of other security and audit-related enhancements. And again, this is stuff that's due to release very soon, and we wanted to give everyone who's participating today a little glimpse of what's coming, so we can make it well worth your time in attending. So again, I just want to thank everyone for their time this morning, and Aaron, at this point, let's hand it off to Cliff so Cliff can show people what mobile eSig looks like.
Thank you very much, Scott. As Scott said, we're very excited about the mobile solutions. Really, this is something that we've anticipated for a little while and had support for a while for other tablet PC devices using Windows operating system. But we recognized that more and more hospitals, clinicians already have iPads, hospitals are deploying more mobile strategies, and we wanted to meet that demand by developing an extension of our existing platform. So in addition to the traditional signature devices that we support, the Topaz signature GIMs, SIG lights, and other similar pads, we now support specialized electronic signature pads, any of the, as I mentioned, the traditional tablet PCs using Windows operating system that have a built-in functionality to have a stylus proxy as a mouse. So tablet PCs using Windows 7, Windows-based writable tablet screen or monitors that use the Windows operating system. But again, the demand was beyond that. iPads are now an option that we support with HTML technology, and now in Safari on iPad, and we also technically support Android devices, but iPads obviously are the exciting and more prevalent technology there. So I'll talk a little bit about how we actually enable that, but it's very similar interface to what you're for those of you that are familiar with the eSig interface in a desktop environment. The layout is the same. We have an interface that really is the same on the front end, that has our list of patients, list of forms, things that we can sign, and it's now just enabled in the iPad itself. So opening up a browser in there, right now we don't have a specialized application for the iPad on the App Store. That's something that we're looking into, but right now through the Safari browser you can open up inside your firewall, open up the access to the web server. And then we get into the form and have all of that data loaded from the HIS here. The patients that are populating your patient database will be available there and filterable just as with a normal desktop or web form imprint options that are already in use. And now when we open up that form, we have the ability to interact with it with either your finger or with a stylus. So typically we'll have an additional stylus that the patient can interact with on the iPad. And now there are some additional options for eSig that we've added into the platform, not just for mobile, but beyond the traditional signature alone. We can also allow interaction with checkboxes and free text fields, so you can type into fields using the keyboard will pop up on the iPad itself, or on a traditional desktop you can right-click on a field and have some options to self-sign and add some metadata to that field that's available really through your login. But now if I click on this signature field in the iPad, this is where it gets a little, diverges a little bit from the Topaz or desktop signature options. It actually opens up a signature field that we can interact with. And with a stylus, I can sign in the field itself here, and now that signature will show up. Sometimes on the iPad, if you're doing it with your finger, it won't look as as if you'd written it with a pen, but now with a stylus, it can look very much like a normal signature and is just as legally viable. And all that metadata is getting populated just as in our normal eSig process from your HIS. So there's no need to embed or put a label on that. Now we're just taking the metadata, putting it with the form, and sending it on to your scanning and archiving system just as if we'd signed it with another device. So now we click on Done and send that document on to your archiving system, whether it's HPF, Meditech Scanning and Archiving, or any host of the other applications that we've interfaced with before. So all of these options now, beyond just the USB attached devices and having localized at a registration area, now we can walk right up to a patient's bedside and take that signature to the patient wherever they may be. And there are some customers now who are actually looking at deploying these more widely in areas because the iPads are prevalent with other functions in the hospital. They're using them for other applications, and this is a logical extension for us. So we're continuing to do development on this platform, again, to meet the needs of hospitals where they're going. And with that, that concludes the mobile solutions overview. And I'll pass it back to, I think we'll pass it on to Ben.
Excellent, thank you. Appreciate everybody joining us today, and basically I'm going to go ahead and go over a couple of different things here. Like Scott mentioned already, I'm going to go ahead and cover different aspects of our application suite. One of those things is the actual Visual Workflow Designer. Restart this here, 1 second. So one of the things that we've talked about is we've always tried to make things a little easier for everyone who's actually having to use our software. And one of the things that we heard from you guys is instead of using an actual wizard-based solution to be able to design the routes and design the workflows, it was discussed and mentioned, geez, we want it to be even easier. We want everything on one screen. We want everything to be kind of a drag and drop interface and make everything easy. So we went ahead and designed an actual application, Visual Route Designer, which can be used to actually design the route that's used in the workflow process. So the other thing to keep in mind is we are listening to everything that you guys are asking and everything that you guys want for enhancement. So just kind of keep that in mind and post questions, post concerns, and other ideas into the actual chat window and dialogue. Another thing that we've added into the mix is the actual functionality of being able to do conditions on our dispositions. Now, for those of you who aren't familiar with what a disposition is, that's basically what happens at a step or what happens at a final process that is kind of exterior to our system. So, for example, a disposition might be sending an email, might be exporting an image, might be writing to a database. Any sort of number of dispositions we can actually do, and I'll illustrate and show that in a little bit. So we can actually put conditions on those and constraints on those that says only do this if certain instances. Another thing that we've added is notes. So if you need to actually just stick some notes in the actual workflow to say, hey, I'm working on this, or hey, here, don't modify this, or this is still in testing, or whatever. It's just kind of a visual cue to your actual administrators of your workflows. It's nice to just kind of keep comments in a placeholder for your thoughts. And then the other thing is we've added an additional disposition to be able to start additional workflows. So if for some reason you need to spawn off an additional workflow to say if a dollar value is over a certain amount, then we can also do that as well. Another thing to keep in mind is because this is even easier, we can actually sign out permissions and actually allow your administrators of each individual workflow to actually do their own administration if you want them to, so kind of a distributed administration. So it doesn't always have to be your IT staff to actually do the rebuilding and redesigning of your route. So think about that for a little bit here as we go through some of these screenshots here. And I'll go through these screenshots, and in a little bit I'll show you kind of how it works, hopefully live. So when you first enter in the Visual Workflow Designer or Visual Route Designer, excuse me, you're presented with this screen. It's just a little helper dialog. It kind of walks you through what stuff does, which is what I'm going to go over here. To actually get rid of this dialog, you can just click anywhere and it'll actually get rid of that screen, and it'll show you something similar to this. And it's, like we said, it's a drag and drop interface. So one thing to also keep in mind is if you're used to that old style, that old wizard format, and you really like that, and you get in here and you say, geez, you know, I want to go back to that old classic view. That is still an option there at the toolbar at the top, so you can click on that and actually get back to that old format. It's just kind of nice to know you can go back to the old way for now if you need to do that. On the right is your actual route. So you're going to actually drag and drop stuff here to actually add elements. You're going to first basically go through and design your route. So what steps are they going to take? Each one of those icons signifies a different type of step. So you have routes, you have roles, you have groups, etc. Once you actually add your step, you will then go ahead and add options. So these can be attachments, these can be signatures, these can be things of that sort. The new one is that little yellow icon, which is the notes thing that I was telling you about a moment ago, where you can actually add prompts and dialogues and statements onto your workflow. Now, those are only for administrative purposes. And then the other thing is the actual step actions. These are the step actions or the step dispositions that I was referencing. And these are the things, like I said, our email, our exporting out PDFs, or exporting out TIFFs, etc. And then at the bottom there's a little trash can. So if you're designing your route and you say, geez, you know, I don't want this here, or I want to get rid of it altogether, you can actually take it and drag it down to the trash can and get rid of it. So it removes items from your actual route. So when you actually drag an item from your steps off to the left, you'll drag it into your actual drop zone off to the right, and it'll actually pop up and show you, in this particular case, a role step dialog. So this is where you actually configure your actual step. Okay? And then after you do that, you do your options, like you said, kind of repeating myself here a little bit just to show you what the actual graphics and icons look like as we go through this. Off to the right there in the lower portion, you can see that I've added that signature there, and it just kind of hangs out there associated with that step. So it's a good visual cue to say, hey, you know, looking at this real quickly, on that step, I have an actual signature applied. It's a good visual indicator. We try to make sure everything is visually appealing and easy to understand, and at a quick glance, you're able to actually see these items and these actions that are visually defined at each step and at each disposition. This is another one for step actions. Again, very similar, just kind of hangs out there on the actual disposition. If you want to have multiple actual dispositions, you can do that as well. It just starts adding them up and on your actual step itself to actually display those. So this actually indicates we got 5 different final dispositions that can occur here. And then again, trash can, you just drag it out of the trash can. Notice there, once you get it hovered over there, excuse me, it'll actually turn to a reddish pinkish color, and that's how you know, geez, I'm about ready to throw something away. Do I really want to do that? Etc. Okay, so let me go ahead and jump out of here for a minute and go into my desktop and show you, hopefully, the Visual Workflow Designer in action. Okay, so we log in as normal. This particular user has the administrative functions. We're going to access it the same way. So if we hit workflows and we hit edit inside our workflow.
I might be the only one, but I'm not seeing anything quite yet.
Oh,
there
sorry.
it goes.
Let me restart here.
I think we're good to go now.
Okay, you see the workflow administration screen?
We do.
Okay. How I got to that again? Let me step back one. Is off to the left. I hit workflows, and I hit edit here, and that is how you actually get to the actual workflow administration screen. Those of you who have modifications or done modifications before are familiar with that and are used to that. Everything here under route are what you're going to be able to modify under the actual route designer. So you're used to actually clicking this modify route. In this particular case, we'll go ahead and click open the visual designer. And it looks pretty familiar, hopefully from the screenshots here. If we go ahead and add an actual item, again, we get the dialog box. These are all going to be departments in this case. We can do this based off of roles, off of departments, off of groups. Basically, anything that you can do the old way, you can also do it in this new route designer. We can actually reorder and reorganize steps just by dragging and dropping them. One other thing to consider is the idea of the conditional actions. If we actually wanted to say, okay, we're only going to route to the IT administrator based off of if the department is IT. We may do something like this to actually do conditional steps. Now, when you do that, it does 2 things. It adds a little dash line around your actual step as a visual indicator. It also puts a little FX there just below the little icon just to show you and visually display that it is indeed an actual conditional statement. So we're, like I said, we're trying to make things easy to see, easy to understand, all on one screen, and able to do things. Prompts, same thing, drag and drop, or excuse me, not prompts, for notes into development. So it just leaves a note here so you can keep that in mind for future reference or like I said, to make notes to other users who are administering this workflow. And again, to illustrate the trashing feature, we can go ahead and drag that down there and it goes away. One thing to keep in mind is after you've made all your changes, you're going to want to hit your actual save function. it pops up and says that it's saving. It displays to you real briefly, and you may not have seen it, but it displays you a little saving icon. And once that's done, you are all set and good to go. Okay? So really, we tried to make this real simple, real easy, real functional for your end users. One other thing, if you want a little more of a visual indicator, is there's little question marks here on each step. If you click on that, it kind of gives you a quick overview and a quick summary of your step info. So that'll give you another visual indicator. If you like to, see those words spelled right out, you can do that as well. Okay? So that kind of gives you a quick overview of the actual visual workflow designer. Next here, I want to go ahead and step forward into the next realm of things, which is the actual content management side of things. I'll give that a minute here to catch up. Okay. Hopefully you should be seeing the PowerPoint presentation again there at this point. Content management. One thing that we've heard from some of our customers is it's great that you guys can output PDFs and TIFFs and images and index files and everything, but that doesn't necessarily solve all my issues and all my difficulties. One of the things that we've heard is how do I include everybody into the mix? And kind of, when they say everybody, they mean everybody in the whole hospital. So what we've done is we've added this whole new functionality, this whole new component to the suite of our software for content management. And we can actually do document archiving into our system, either from the FastFlow suite or from external sources if you guys have some other way of giving us data electronically. And you can do stuff for administrative purposes, for revenue cycles, for HR management, for payroll. It doesn't matter to us what you want to use the content management system for. We can actually design an application to suit your needs, or depending on your level of expertise, you can actually design that application and layout and design yourself. If you're thinking there's a lot to this, there are a lot of components to it depending on your level of knowledge of how everything works, but we've also have people as well as base templates of applications out there to help get you started. So you're not going to be doing everything from scratch here. What is the content management system? Well, in its simplest term, think of it as just a gigantic filing cabinet, an electronic filing cabinet, where you can basically take all that electronic content, and it doesn't matter to us what it is, whether it's a PDF, an Office document, a movie file, a scanned document, a TIFF. It doesn't matter to us what it is. And you can actually file that into our system, and we will help kind of keep track of that data for you. And what you can do is you can search for that data based off of metadata that is important to you. That can be either at a folder level, and we'll talk about that here in a minute, which is kind of a higher level, or you can also search individual document elements. So what do we do? As we said, we take data. It doesn't matter to us whether it's an email, whether it's a saved file, whether it's a scanned image, whether it's something that came from your fax machine, whatever. We can take that data and we capture it, and we can actually send it on to our content management system. From there, we can either throw it into a bin, and it can be manually indexed, meaning you can assign values that are pertinent to it, like document type, or if it's an invoice type of thing, then you can actually add invoice numbers. You can, whatever's important to you in your organization. You can do those manually. If your system that is sending us the data can actually send us those index identifiers, then we can automatically populate that data, and thus there's no manual intervention there. Once we actually get all that data and capture it, there's a number of different things that we can do with it. We can just allow users to immediately access it online. They can search for it. The other thing that we can do is we can actually take that data and we can actually kick off workflows. So if you want to be able to take that document and start a workflow, like every time I receive an invoice document, maybe it has to be reviewed by a certain set of people, or maybe if it's over a certain amount, it has to go to somebody. We can actually take that data and actually use those metadata elements to determine routing through our workflow engine. I'll go ahead and show you a couple different examples that we have here. Now, keep in mind this is only 2 different examples of actual CM applications. And I'll go through this real quick using screenshots, and then hopefully I'll be able to have some time still to go through and show you a quick demo of how stuff works. So this is a quick search for vendor information. Real quick, it shows you just a simple search screen. You key in what you want, 1 or more elements. It returns data. It returns whatever matches. In this particular case, when you browse the folders, it'll return maybe POs, maybe invoices, maybe tracking slips. It doesn't matter to us what we're holding on to. One thing to note here is the tree structure is truly a tree structure. So we can actually organize these in any fashion. It's not just a linear list of files. You can actually organize these in a structure that makes sense to your organization. So if we go ahead and select the invoice here, this is what you would see in theory. When you actually open up the image, it actually gives you the image on the left, or the document on the left if it's something that we can display in our viewer. If not, it'll open it up in its native format. Off to the right there are the attributes that we were talking about. Now, we have 2 types of attributes. Those are folder and document attributes. The folder are just kind of the generic ones, you know, of grouping. So the payee name, the payee ID, etc. And then the document attributes are very specific to this exact document. Okay, and these are all customizable, all whatever your organization deems important. We also have notes functionality. Excuse me. So if you were to have the need to actually drag and drop some notes on there to say, hey, you know, confirm this is the right amount, or, you know, maybe this is the wrong tax information, or whatever, you can actually drag and drop notes onto our content management image. And those notes will actually appear in an actual tab, and you can search through them. You can actually reply to different users. One thing to mention here is this is all permissions-based. So maybe you'll have some users who will be able to do this and some users who won't be able to do this. It's all up to you on how you actually design and implement your permission structure in your organization. If you don't have something that's specific to an actual image, you can actually still create those notes to say, hey, somewhere around here, you know, we should consider this piece of information, or maybe we need to fill in more attributes or something to that information. Up at the top there, where the arrow is pointing now, is where you're going to actually drag and drop that information onto the actual screen. Off to the right here in the actual notes, you can actually reply to different people's comments. So you can actually have a tiered tree level of notes and replies. So if you want to exactly reply to Mike Wallace's comments, you can actually do that if you have the proper permissions. And the last tab off to the right there is the folder structure. So once you get into a specific folder and you may want to see additional information surrounding this particular folder, you can actually do that easily from here as well. So this may be supporting information like contracts, or might be an actual shipping document, or whatever. Whatever is actually in this electronic folder. Okay, so keep in mind, if you're comparing it to a file cabinet, it's basically a folder within a file cabinet. This is where you can actually start workflows. So if you need to say, geez, you know, this is a specific document, or this is something manually that needs to be reviewed by somebody, you can actually select and start a workflow that'll actually send this on to a specific set of users, or a specific group of users, or a specific route. Whatever is predefined there is what will actually appear there, and your administrator can again assign permissions to what you have for workflows. Once it's actually sent on through the workflow process, it looks pretty much the same as other workflows. You can review the actual document. We can associate a PDF image, excuse me, a PDF document for workflow purposes, so you can fill it out and actually pass that along the route as well, just like our regular workflow processes. You'd actually approve the document, and it would move on to the next step. If for some reason you decided you didn't want to approve it, we also offer options for rejecting workflows. So if for some reason you say, geez, you know, this isn't right, or no, this is missing information, we can reject that back to the previous steps. HR is another solution that's out there. We may have a need to design a different application depending on your needs, but like I said, we have a couple out there that are already in existence. HR is another one of them. So one thing to go into a little more detail here is these aren't all just text boxes in the searching. We can actually do lookup fields. So if you want your users to specifically have to select a value rather than keying in a certain value, they can do that. We can actually do dates. And when you're searching for stuff, sometimes you don't always know the specific date. So we can do date ranges as well. So that's something else to consider in the search dialog. One other thing I wanted to kind of point out to you is we've been kind of focusing on the Browse Folders tab. That tab just gives you the whole structure of whatever structure for your application. Some users find it kind of cluttering. Some users don't want to see the empty folders. So we've also kind of given you two options or two views there. One's for the Browse Folders, which gives you the full tree. The other one is just kind of a condensed summary, big list, basically, of all the documents that currently exist. So those are the difference of the two tabs there. So if you're wondering, geez, what's in that other tab? There you go. And then the other thing to keep in mind is at the top there, it gives you just kind of a breadcrumb, a little snippet of, geez, what did I exactly search for? Was that the right search criteria? So after you search for something, it gives you just kind of a breadcrumb to give you a list of information of what you searched for. You don't have to always wonder, you know, what did I search for? Or go back and research for the same thing to make sure you're doing the right thing. So let's look at another document here. If we go ahead and open up license, again, it looks pretty similar. I do want to point out a couple other features that we haven't discussed yet. Is the items across the top are your toolbar entries, and some of them we've brushed against, and some of them we haven't touched on. So I just want to make sure I hit those real quick. If the document has multiple pages, you'll see that here, and you'll be able to navigate to and from the pages. You can actually rotate documents, so if it gets scanned upside down or something like that, you can actually rotate those documents around. That's kind of an auto zoom, so you can zoom to fit right on screen, so you don't have to manually zoom it using this icon here. This is the actual zoom icon, so you can zoom in and zoom out using that. Start a workflow we've already talked about. So you start a workflow and it gets processed and sent to other individuals. Email, you can actually take this document and email it outside the organization if you want to. Again, this is permission-based, so it doesn't necessarily mean everybody will have that permission, but it is an option to allow your users to be able to do that if you want to. Same thing for saving it to a local machine. You can actually save it to your desktop, and you can save it as a number of different formats. So if you want it as a PDF, we can do that, a JPEG image, etc. We have a number of different formats you can save it to. And you can, of course, print the document. So when you hit that, it'll print, and you'll see it on your printer like you're used to with any other document out there. And we already talked about dragging and dropping the notes out there. So I just wanted to hit those. And all of those are permission-based. So keep that in mind that you may or may not always have access to those. Here's just a quick screenshot of dragging and dropping a note. Once you drag and drop it from the top toolbar down onto your document, you will actually see a little dialog like this, and it'll say, hey, add a note. You just enter in your comments and hit save, and we keep track of that for you as it relates to the document. If you're in an actual document and you say, geez, you know, there's something pertinent here that I need to search the rest of the system for, you can actually do this using the quick search links. And what those are the little magnifying glasses beside your folder attributes. So in this case, if you click that little magnifying glass, you would be searching your system for all of the folder attributes of clinical. in this particular case. So it's a quick reference, and it's an easy way to do a search rather than having to go back to your main search screen and do your search. It's an option there. Folder navigation we brushed upon a few minutes ago. In this particular case, these are other related documents in relation to your employee. And then one thing that we've talked about briefly is permissions. I just want to show you a couple of those screenshots real quick. The permissions that we have as far as CM goes is surrounding a number of different features. Those toolbar features, what the user has access to within the CM application, and that varies depending on each user. So if you didn't have permission to start a workflow, you might see something like this, for example. Permissions can be based off of the folder level, so you can say that somebody can only see certain departments. You can see that they may have only permissions or may only need permissions to view certain subfolders, or maybe even at the document level. Maybe you can say, oh, well, they can only see documents of document type invoice, and they can't see anything else. You can do that and customize this permission structure as you need or as your organization needs. And then once you actually access the document, these are some example of permissions of what the user can actually do with that document. They may be able to add notes, they may be able to email it, they may be able to delete it. It's up to you on what you want your end users to be able to do. Okay, now let me show you a quick demo again. Give that a second here to catch up. Okay. Aaron, you'll have to let me know if we're not seeing the desktop yet. Off to the left,
that's perfect.
Okay, perfect. Off to the left, there's a new menu for FastFlow CM. In this particular case, we'll go ahead and view an HR application. Again, here you'll search for whatever you need to. If you leave a search blank, you'll actually get back results all the results that you have access to. So in this particular case, this is what the user has access to. So let's just take a look at Jim here. Here's a number of different documents. We go ahead and open up a license here. It looks pretty similar to what was on the screenshot. So here are all the menu items. Just drag a note just to reiterate. We might add certification confirmed or something to that effect. The note's saved. Off to the right here, if we go to the Notes tab, we can actually see our notes. Here we can actually see our tree structure of notes like we talked about. I didn't really display that in the screenshots. If you right-click on one of these icons, depending on your permission, you'll be able to reply or edit or delete these notes depending on your permission. Another feature that I didn't show you in the screenshots is if somebody's created this and actually put it on something that is difficult to read or you need to be able to read that, there's a little hide button where you can hide the notes. So if you click on that, you can actually just kind of temporarily get rid of those notes just so you can read the document a little easier. It's a nice little feature that was added based off of some recommendations. Okay, so to go through and show you how this might work from an HR standpoint. Going with a scenario of we have a new user or we have a new employee that needs to be added to the system. We might go through and type it in here. And down here at the bottom, oops, I hit reset. Let's try that again. Down here at the bottom, there's actually a create new folder, okay? And what that does is if the folder doesn't actually exist in our system, then it'll actually create that folder from scratch for you. So if I click on this, it'll actually pop up and say, hey, do you want to create this new folder? Are you sure you want to do that? Just kind of let you verify your data, make sure it's all correct. Once I actually hit create, it creates my folder for me. It's just a placeholder, and it's currently empty now. Let's say I want to go ahead and take this information and actually upload a resume or something like that. Again, if I right-click on that folder, whatever folder you want to actually upload data to, you'll have an upload prompt. These are the metadata elements that are specific to this document, okay? So it might be a resume, it might be a hire document type. From there, I can select the document on my machine. I'll go ahead and upload the document. It does kind of a pre-upload process, lets you confirm that the data you typed in is correct, make sure everything is valid. If it wasn't, you could get rid of it and decide not to upload it. To complete the upload process, you hit upload, and it actually uploads the document and gives it the information you decided. So this is the tree structure. Again, this is the actual quick structure or the burn down list of your actual documents that are pertinent. If I click on that document, it'll actually open it up for me, okay? So again, this is the same process, the same screens that we've been seeing before, okay? One thing to reference is we're coming out with a redaction process too. This is actually a new process that's still in process, or excuse me, still in development, where you can just actually start drawing boxes on here. Again, this will be permission-based, so if you don't have the permission to do that, you won't be able to. If you have permission, you'll also be able to click this little red icon to delete it, so you can get rid of it that way as well. Let's go ahead and just start a brief workflow here. And I won't go through this whole entire thing just because I feel like it's kind of repetitious, and I know there's a lot to see today, so I don't want to hold anybody up too long. So there's a little screen that says, okay, we've started a workflow for you. What do you want to do? If you hit go, which we'll do here in a second, we'll go to the workflow. If you hit OK, it'll keep you on this main screen, okay? So I'll hit go, and it brings up my workflow. Now in this particular case, I have off to the right, I have my workflow image, what started the whole process. In this case, it was the resume, okay? Off to the left, I have my actual image of my PDF. Now if I click on that, I can actually fill it out as I normally would need to. We can fill out a date, an effective date, whatever is pertinent to us. Maybe they need a laptop and a monitor, etc. Upon doing this, I can go ahead and hit submit. It fills it in as normal, and I can approve that, okay? Now, I won't go through this whole process, but the final objective is that it's gone on to the IT manager because this user was part of the IT. If it wasn't, it would skip the IT manager. Ultimately, what's going to happen is I have this set up so it'll appear back in the content management system. So it's a whole self-contained process where your users don't really need to do a whole lot other than fill out the form and hit submit. It's made, hopefully, to make your lives easier and to make the whole process of a workflow much easier to be able to manage and process. So that kind of concludes my processing. And at this point, I want to go ahead and hand it back to, I believe, Aaron.
All right, thanks, Ben. That was a great demonstration. At this point, we're going to open it up to questions. We've had a few that have come in during the presentation. But at this point, if you have any questions for either Scott, Cliff, or Ben, or any comments as well, feel free to send those over to the Q&A window. The first question that we had come in reference to e-signature, James wants to know, is it possible to print through e-signature from the iPad? How does that work? And Scott or Cliff, can you speak to that?
This is Scott. I think Cliff may have stepped aside for a little bit. He's on customer site today. The ability, if I understand the question correctly, can we print from the iPad? Yes, assuming the iPad is connected to an internal network in the hospital. You're running the application. Basically, it's an HTML page. Once you're done having the patient sign, you certainly have the ability to submit that image into the EMR, but you also have the ability to print. There's other functions that are available because you're still within our web form imprint application at that point. So short answer is yes, but there's a few conditions, to make sure that normally that iPad can print, because there are sometimes iPads are attached and don't really have any access to any printers. In that case, we would be blocked from doing so.
Great. Another question in reference to e-signature. Is e-signature HIPAA compliant?
Oh, yes, it is. Absolutely. It's been something that has been a while in development. I know myself, coming from a hospital background, in 2008, 2009, electronic signature was there. There were very few hospitals doing it. There was a lot of apprehension about the legal ramifications of it, but as time moved on, it is really becoming a mainstay in most healthcare organizations. And it also seems to be that one piece that sort of still hangs outside of the EMR. Many HIS systems do a tremendous job of eliminating a lot of the paperwork, but there's still that challenge of there are pieces of paper and consents, discharge instructions, things of that nature that we still need to capture a signature from a patient. And that's always a challenge. Kind of historically, it's been, well, we'll still print that and then get the patient to sign it, and then it falls on somebody's responsibility to get that scanned back into the system, either delaying a process, which can actually slow down revenue cycle, and also affecting the patient's experience, because sometimes that person gets busy doing that rather than getting the patient discharged sooner. So now we see electronic signature really coming front and center. It's on most of the HIMSS analytic surveys that were done in the last couple of years. It ranks at the top of what a lot of hospitals are looking at doing, mainly because they're looking at how do we get rid of this existing paperwork. Now that we're up and running our EMR, whether you're stage 5, 6, or 7, these are still challenges that exist, and electronic signature option is a great way to address those, and is becoming much more commonplace.
Okay, a couple questions about e-signature and specific archiving systems. Actually, two questions here that are kind of related. One, how do you get signed documents into Meditech SCA? Other question, would this process work for HPF? They note that they have a McKesson product and that they have some forms designed for print, but of course plan to have them signed electronically. Can you speak to that integration and how that works?
Yes, different HIS systems, have different ways of getting content into their EMR, but one kind of universal method that we're used to working with is they generally have a directory or a folder that the archival system is looking at on a very frequent basis, and it's looking for any new content that lands there. So when we're done capturing a signed consent form, let's say, we can save it into that directory, just placing that we can compress it down to, say, a TIFF image. There's other formats are certainly available, but for example here, I'm going to say TIFF image. We're going to place that TIFF image into that folder. The system will sense that it's there, and because we generally barcode all our forms with not only the form barcode, but also the medical record as well as the visit ID or the encounter number, the system can automatically auto-index that in, meaning the system can grab the image, essentially scan it right into the system, and know exactly where to put it in that patient, which encounter, and which part of the file to place that document without any human intervention. So, you know, again, it's that can vary a little bit from product to product, but you know, generally speaking, you know, that's how we do it.
Okay, another question that just came in on e-signature on surgical consent. Can you free text the procedure name on the consent prior to signing?
Yes, you can have free text fields. I believe Cliff showed on one of the sample forms on his mobile e-sig demonstration there was some free text fields. It'd be a matter of setting the form up for that. But yes, you know, the short answer is yes, you can.
Okay. And we just got a question that came in about recording the webinar. We are, in fact, recording this session as well as tomorrow's session. We'll send a link out after the event so that you can view that at your leisure. We'll also give a copy of the slides as well. And as we're taking questions here, I'm going to ask our next presenter, Emma Bruinick, to go ahead and log into the teleconference, and we'll move right into her session after we conclude questions. You can do that by going to the top of the WebEx interface, going to Communicate, and Join Teleconference. So we'll continue the questions as Emma gets dialed in. Moving on to questions around content management. First question we got was, is there a storage limit for CM?
Not practically. Like most systems, it really depends on the amount of storage that you have available. If you're talking about a very large IDN, let's just say, you know, you're talking about a system that's maybe 80 hospitals, there may be some practical reasons why you might want to break that content repository down into, you know, locales versus trying to put everything together. So, you know, there are design considerations, but really a lot of that has to do more with the underpinnings. We use SQL Enterprise as the underpinnings for this, and Microsoft has recommendations as to, you know, how large you should let databases grow with content, you know, graphical content involved. So, you know, as far as ourselves, we don't necessarily impose a limit that's, you know, that you would hit in a practical basis.
Another question on CEM. Dina wants to know, are there any LaserArc customers that are switching to this product? McKesson no longer supports LaserArc. Scott, have you heard of anybody in particular switching because of that reason?
No, I can't speak to anyone that I know in particular. You know, it definitely would make sense because this would be, you know, kind of a good kind of replacement for that. You know, no doubt we probably do have some just out of our, you know, 1,200 customers. I can't remember, you know, anyone having that in their history just off the top of my head. I'd have to look a little closer at that. But we could probably talk with someone offline and get an answer to that.
Okay, I had a couple questions about the nature of CEM versus an EHR. Just to kind of summarize some of those questions, Scott, can you kind of speak to the nature, or Ben, speak to the nature of CEM as a non-clinical storage platform?
Well, this is Scott again. I mean, I think you kind of hit on it right there. I think a content management system, you know, such as what we design, this is really there to sort of complement your electronic health record, not become an option for it. If you look, and I've been through this myself, you know, I came from a facility that was Stage 6 certified. After becoming Stage 6 certified, there was still plenty of paper floating around the hospital in the revenue cycle arena as well as support service arena, and that's really what this product is for. It's for that part of the hospital. There's so much paperwork surrounding employees, contracts, accounts payable, just numerous other things that, you know, sometimes your HIS system does, sometimes maybe your HR system does, but maybe these are things that we can do better with a more open system like what we offer with content management or workflow. And that's really where the strong part of this is that, you know, we can address those areas and really gain some strong efficiencies in revenue cycle and the support service area without, you know, crossing over to where we're holding patient content, because holding patient content, you know, there's a whole challenge in that in itself, as well as we're fortunate to be partners with most HIS systems, and, you know, we respect, you know, the boundaries between what we do and what they do.
Very good. We've got a question for Ben here. Carla wants to know, can we scan all documents and their content if we are searching for something? If we scan in our policies and want to search for all policies that contain the word nursing, is that possible, for example?
Assuming that they're not truly images, then yes. If they're like a PDF or something like that, then we have little plugins and add-ins that we can actually put into the system to actually take that information and actually index it and allow you to search for that.
Okay. Looks like we're wrapping up on questions here. So if you have any final questions, go ahead and send those in. Last question, I think, Ben, you kind of touched on that. Just to recap some of the applications that are applicable for content management.
Yeah, we have a couple of different templates out there. So some of them that I know have come into play are AP applications for accounts payable, payroll, HR, what else? Compliance, purchasing, revenue cycle. Scott, do you have any others that come immediately to mind?
I think those are, you know, kind of the big areas. I mean, there are a lot of, you know, breakdowns of those, but, you know, there's, you know, definite challenges that, you know, we hear from our customers of things that just, you know, fall through the cracks. I was just, you know, talking with a customer a few weeks ago just about, you know, contract management. Most hospitals struggle with their contracts. I think most vendors write contracts to hospitals with little hidden expiration dates and renewal dates. It makes it very challenging to be able to store those in a content management system that could initiate workflows to get people to look at things based off of a date that's coming up. That in itself is extremely powerful, and considering the dollar value of some of those contracts, there's so much to be gained there. But I mean, there are, you know, that's just one example of many, you know, to where this technology fits in really well, and it's a good complement to really whatever HIS system you currently have.
Great. Well, I want to thank our presenters, Scott Fuller, Ben Smith, and Cliff Babbitt, for the presentations, and for everyone for the questions. If you have any further questions about these products, feel free to contact us at formfast.com/contact. As I mentioned, Scott will be leading the interactive solution improvement session later on today, so we definitely encourage you to stick around and give us your feedback on ways you'd like to see the products improved in the future. At this point, we're going to do a poll question to get some of your feedback on some of the technology that you are interested in seeing in FormFast products highlighted and developed further. So I'm going to open the poll now for you to answer. As we give you a little time to complete that, just a reminder that we want you to join our mailing list in order to stay connected with FormFast and learn about the latest solution offerings that we have for you. I encourage you to do that at our contact page, once again, www.formfast.com/contact. Signing up only takes a couple of seconds. It can be done by visiting that page and clicking on that icon that you see on your screen. As for upgrading products, if you'd like to update a FormFast product, we encourage you to visit our new user group site, which is formfast.com/usergroup. There you can register to get access for many helpful resources, including an interface for requesting an update. The product update section can be found by clicking the update icon on the home page. And from there, you can see the latest version numbers of the products you own and request access to the download. All right, it looks like the poll is wrapping up in 5 seconds there. And according to the poll, it looks like there is a strong interest in e-signature as well as the eForms management, output management, and barcoding, and the workflow as well. So thanks for taking a moment to fill out that poll. At this time, we're going to move to our user spotlight section, and I believe we have our featured speaker, Emma Bruinick, connected to the phone line. 1 second here as we do an audio test. Looks like we don't have Emma on the line. 1 second here. Emma, can you hear us? Looks like we're having a little bit of an issue with the WebEx interface. Bear with us. Emma, can you do an audio test for us, please?
Hello, can you hear me?
Very good.
Can you hear me?
There we are.
Oh, perfect.
Perfect. And Emma, we're going to ask you to please mute your computer speakers as well.
Okay.
Very good. So I will make you the presenter here. And the floor will be yours.
Hi. Hi, everyone. I have been working with Alberta Health Services for over 17 years. Did something happen, or? Okay.
All right. So now you should be the presenter. Let's see here.
Excellent. Thank you. Hi, everyone.
I
have worked with
having
Alberta
some
Health
issues with the WebEx interface, but we'll work our way through it.
Can you hear me?
If necessary, Emma, I can hear you. We might have issues with the driving the slides. So if you like, I can just drive through the slides if you just want to tell me when to click the next one.
No, I seem to be able to do it.
Oh, very good. I think we're up and going now. Very good.
Okay. I work for Alberta Health Services for over the last 17 years in one way or another. AHS is Canada's first fully integrated province-wide healthcare system. It brings together 12 formally separated health entities in the province, including 3 geographically based health authorities. Our mission is to provide a patient-focused, quality healthcare system that is accessible, sustainable for all Albertans. AHS has 99 acute care hospitals with 8,118 beds, 5 standalone psychiatric facilities, 21,683 continuing care beds or spaces, plus equal partnership in 40 primary care networks. We also have almost 100,000 direct and indirect employees, about 16,800 volunteers, and over 8,000 physicians plus 27 honorary or associated physicians. We also have students from universities and colleges from both within and outside Alberta to receive clinical education in our facilities. Our goal is to reduce non-healthcare related operating costs so more valuable dollars can go to providing healthcare. Preserving patient safety and privacy is important to us. And by reducing the amount of paperwork sitting on desks before ending up in tray boxes is one way to accomplish this. The process of putting unneeded paperwork immediately into a shredding box is what should be happening, but we have to be realistic and remember that the first concern in our business is patient care, and that comes before putting extra paperwork in the shredding box. We're also always looking for ways to reduce our environmental footprint in our communities, and if we can print less, we save on consumables like paper and toner, plus the energy that it takes to produce the printing. FormFast is helping us with these three goals by allowing us to reduce the cost of paper of our charts and registration forms by only printing what needs to be printed. Using FormFast allows us to customize what is being printed and where, and eliminating shredding of unneeded paperwork. In our facilities, we have 3 major HCISs running, which is a challenge in itself for some IT staff. Fortunately, I'm not one of those staff. Only the facilities that are operating Meditech are configured to run FormFast. There are 7 live servers and 1 test server housing the FormFast software, and one of the main challenges that brings is the consistency of setups of jobs and server configurations, since many of the same type of jobs are run on the servers. We have started standardizing jobs and merges so that we can port from one server to the other with as little custom touches as possible. That's not always 100% possible, as different servers are sending different data files, but this is something we are striving for. Buying from business users is always a big challenge. The business user's goal and the goal of the IT department are not always the same. Even though we have solutions that may save them time and money, their top goals are patient care, and that is their focus as resources are limited. All of our FormFast servers run FormFast Print Manager and IP Listener for patient registration, and some automated forms that need to be printed. For example, if a patient is registered that is also in an outpatient program, the registration forms that print at the registration desk and a different form will also print at the outpatient program, letting them know that their patient has been admitted into the hospital. Other types of forms that are printed via the Print Manager are allergy reports, blood bank forms, pharmacy, MARS, WCB forms, financial forms associated with patient registration, accounts payable forms, client and patient statements, and public health consent forms. Along with that, we have one server that runs HL7, Tracker, and Form Imprint in 8 facilities. With that, we have many forms that are in place for demand printing. And of course, we all have Form Designer. What we are saving now is time, lots of time for our nursing staff by using the FormFast Form Imprint. Before Form Imprint, the nursing staff would pre-assemble all of their chart bundles that they would need for the day. This could take anywhere from 15 minutes to an hour, depending on how many forms the chart bundles and of course, how many bundles are being built that day. When a patient is admitted, the staff would choose a bundle and either place labels on it with the patient's information or use a hospital card to emboss the patient information onto the chart. Problems with the labels are that they're usually placed in the same spot on every form of your chart, and your charts will build up in one spot, making a different challenge for your health records department. Problems with the embossing cards is that the quality of the print is not always the best. Forms need to be continuously reordered to replenish inventory, otherwise forms need to be tracked down if they run out. When forms come in, they have to be sorted and added to the filing system that they are using to store. And if you have lots of forms, they take up lots of space. Forms are consistently being revised with new protocols, procedures, and information. These forms need to be ordered and replaced in the filing system. What happens when a staff does not reorder newly revised forms and the wrong form is used during patient care? Usually nothing serious, but it could be a huge patient safety issue depending on which outdated form is used. And lastly, chart bundles are not consistent. It depends on which chart is being built by which staff member at the time, and if all the forms are actually available when they're building them. Along with saving time for our nursing staff, form imprint also improves patient safety. A full inventory of all forms are always available, even the rarely used ones. When forms are printed using form imprint, every form has patient information added to it. In the past, and this is not a approved practice, but it does occur, nursing staff finds the form needed and does not label or emboss it with patient identifying information right away. Nursing staff then goes to the patient, fills out the form. Once done, remember it is still not labeled, returns to the front desk to label it and add it to the patient's chart. But another patient needs immediate assistance. What does the nurse do? The form is now on the desk, still with no identifying information, and leaves to assist the other patient. It is now the end of the day, and the form is still sitting on the front desk, and the nurse has to remember which patient the form is for. If they can figure it out correctly, that is great. But if they guess wrong, or they have to throw it away, and it could contain critical information. With form imprint, that is never an issue again in the facilities that use it. Staff goes to the correct location for a form. Whoops, my thing's flipping. Oh. Staff goes to the correct location for a form, but the forms are misfiled and the wrong form could be used. I seem to be stuck here. I can't move on.
So I can take control and then drive. Need be.
Okay. So if you can click it.
There he goes.
Thank you. Another big issue is a newer version of the form is available, but did not get ordered, so staff are still using the outdated version. If it is a drug protocol, it could be a huge patient safety issue. Or staff is not aware that there is a new revised form available and are still using the old form. This is extremely important when it comes to protocols, that the forms are updated in a timely manner. Okay, if you could click, please. Click again. FormFast, a form imprint is independent of your HCI system. Again, please. We are using form imprint in one facility to assist with downtimes. Because FormFast works independently of your HCIS system, all patient information is still available in Forms imprint. This allows all your forms to maintain a consistent look at all times. The only thing that is missing on the charts is an account number, as that is only assigned at the time that the patient is registered into your system. We even took it one step further, and when a patient is registered during downtime, an extra copy is printed that stays at the registration desk, so the staff do not have to track down any charts when the system is back up. They have a complete account of everyone that was seen during the downtime sitting at their desk. Click, please. Every form is easily accessible and available to all nursing staff. Click. That is how FormFast is helping us save time and helping us with the environment. Click, please. We have only scratched the tip of the capabilities of what FormFast can do for us, and we hope to continue to build on what we already have in place. Thanks.
Very good. Thanks, Emma, for taking the time to share part of your success story with FormFast. This time, we'd like for everyone to consider asking questions, especially if you're a new user of FormFast. It's a great chance to find out some ways that you could better use the product. One question I have for you, Emma, is you have a large IDN with multiple facilities. What are some ways that practices you've put in place to standardize across those multiple organizations?
Well, there is a plan, and it's just in the beginning stages, but they are hoping to maybe merge into maybe one or two different HISs instead of having three major ones. So that would, again, standardize it that way, but that is just being under investigation right now.
In terms of a forms committee, do you have a centralized forms committee for the entire IDN, or is it per facility? How is that structured?
We have a centralized one for the whole organization, and in the past, when we had all the separate entities, everyone had their own that they were maintaining, but they're all now housed in one place. They're all inventoried. If any forms need to be changed, even the ones that came from a former area, they must go through this forms committee, and there are standards of how the forms must look and have the same feel to it, and they must all have, of course, the proper logo on them. So.
Excellent. And I'm looking to see if there's any questions that have come in. And it doesn't look like there are any questions at this time. So I thank you for your time, Emma. And then at this point, we're going to move right along to the next user spotlight featuring Manit Bular.
Thank
I
you.
believe that, thank you. Actually, it looks like we might have one question there that just came in. Laura would like to know, Emma, if you're still on the line, she's interested in learning how FormImprint for downtime was utilized. Can you speak a little bit more to that?
What we've done is, I know FormFast in their company does have a downtime procedure, but we didn't go with that. What we did is for our users, they go right into the grid system of it, and they type in the patient's information that they need for that registration form. And if they put the information incorrectly, including the location, that patient will then transfer up to the proper nursing units, and the nurses can then even print off all their forms during downtime. So it's a little bit of manipulations by the registration staff to know exactly how to put the information in, but they do it quite often, so they don't have that much of an issue. So we have complete charting all the time with either the nurses' charts or registration forms, which have a very consistent look. And luckily, we don't have that buildup of the corner with labels.
Excellent. Okay, so thanks once again to Emma Bruinick for taking the time to be with us. For our next user spotlight, we're joined by Manit Bular from Rideout Health in California. Rideout Health is an award-winning organization with a dedication to performance improvement. Manit and the other members of his team gave a presentation at HIMSS this past year about some ways they're working to improve workflow across the organization, including operational departments. And Manit, are you there?
Yes, can you hear me?
Very good. Yep, looks like we've got the connection there. This time, I'm going to pass the ball over to you.
Okay. Well, thanks. My name is Manit Bular, and I'm a project manager at Rideout Health. And this is the part of the presentation that we gave at HIMSS, so I just want to go over it. And it's mainly going to cover 3 of our forms and workflows that we've had the most success with. So I'll get on to it. So I'll just tell you a little bit about our hospital, some of our forms and workflows, and if you have any questions, I'm more than happy to answer them. So right now we have 2 hospitals, but we are merging them into one. The picture that you see below, I believe it's going to be opening in 2015 in Marysville, California. We do have an outpatient surgery center, a cancer center, and some clinics. And I'm not going to read over everything here, but I'll let you take a look at it if there's anything that interests you. But we do have we're licensed for 305 beds. We have over 50,000 emergency visits last year. We're using McKesson's Horizon Patient Folder right now with the Physician Portal. And our current registration and billing system is QuadraMed's Affinity, but we're currently migrating majority of our clinical systems and even back office to McKesson's Paragon system, which should be live in June of next year. We are using FormFast FormImprint for our barcodes, and we also use FastFlow, which is what this presentation is mostly going to focus on. And then one of the other key stats I want to point out is that we have a little over 1,800 employees, and all of them have access to FastFlow right now. So these numbers are a couple months stale, but I just wanted to point out a couple of them. So we have about 10 or so forms on FastFlow right now. We have 2 audit tool forms that have been processed over 1,500 times, and I'm going to highlight that one in the next couple slides. We have an item table inventory form for new items, price changes, deletions, and that's been processed closer to 2,000 times now with the updated numbers. I'm also going to go over the monthly mileage form, which has been processed over 800 times, and then the personal action form review, which has been 1,800 times, but the PAF family of forms have been processed 2,500 times. And so with the 1,800 employees, we've had almost 800 people log into the system since, and that was as of March, so I want to say the numbers are close to maybe 850 by now. And it's used quite a bit. I mean, within the last week of this data, we've had over 100 people, unique people log in. And when these numbers were made, we had 1,200 forms en route. That's combining all the forms that we have live in FastFlow. So what I'm going to do is I'm going to show 3 different forms, and I'm going to just talk about the old process, the new process, and then I'll show you a screenshot of the form so you can see what it looks like. We have a personal action review form. For all 1,800 employees, a review form needs to be done once a year. And then if you also consider the personal action status form and the new hire form, which are very similar, those are done quite frequently as well, and they basically have the same process. The old process, HR would have to manually data enter into the form. I believe they used to type on Microsoft Word, but I'm not 100% sure, but I knew it was a manual process. They never knew what the form was. They had to go to the director and then the administrator and then back to HR. So they would have to call the director first and see if they had it, or then the administrator. For signature control, if we have a director leave the organization, HR has certain guidelines in terms of whether they can route that personal action form to a manager or if it has to go straight to an administrator. So with this old paper process, it could just kind of get misplaced, but with FastFlow, they're able to pick exactly who the form goes to. And then once they got all these review forms back, they would have to scan and index huge stacks of form into their HR system. But with FastFlow, we've set it up to where it connects to our HR system and populates employee data. So all they have to do is type in the employee number, and it'll populate the employee department, the pay rate, the date of hire, and all the other information that I'll show you on the next screen. The initiator always knows who has the form at all times. They can just go to their sent box and see, oh, it's with the director, oh, it's with the administrator. And we actually just created a dashboard recently where they can see, they can group by director and see how many forms that person has, and they can do quite a few things just by looking at all the active forms. We're able to lock down fields, so the data that was populated from the HR system, let's say HR initiates one for an employee and the department was wrong, they're not able to change that on the form. They'll have to go to the source system and change it, which is the process we want to follow because we want to fix the data at the source. You can easily reject with comments with FastFlow, so the director could reject to HR and say, this isn't my employee. The administrator can reject to the director and say, I don't agree with these comments, and it's just a much easy and quick process with email alerts compared to having to send paper back. And we set this up to where a PDF of the final copy is exported onto our HR system server, and then based on the file name, which has the employee ID, the date of hire, it matches that up in that system, and it indexes and files a copy of this form in that system. So that's completely automated. And then just another little bonus for HR, a PDF copy is also copied onto their network shared folder, so they have easy access to all the PDFs. And this is just a screenshot of the form. So this is what I was talking about in terms of you type in the employee ID on the screen before this one, and all this information here is populated. And one other thing I wanted to point out that's not on the screenshot, we have a field on this form for hours, and the HR system that the data is populating from, it has weekly hours, so it would say 40 hours a week for me. But the field over here on this form, they want to show pay period hours. So what we did was we have a little hidden field right here that you can't see. It populates the 40 hours, and then down here we multiply that by 2 to get the 80 hours. So there's some things that you can do behind the scenes to get around having to change everyone's 40 hours to 80 hours in our HR system. We were just able to change it on the form with a hidden field, and it's been working great ever since. The next form is a medical record audit tool. I'm just going to show you the screenshot first. This red line right here is just to show that the top and bottom of the form, but what this is nurses on each of the units, I think they have to do 5 a week. They'll go through certain charts, and then they'll see if the COA was on the patient's medical record, if the advanced directives were addressed on admission, and they answer yes and no to all these questions. So let me go back. So with the old process, it was completely on paper. There was no version control, so if a new version came out with new questions or different choices for questions or anything like that, it would be a pain to have to let everyone know to make sure that they only use the new form. You'd have to hope that all the forms were turned in because it's just stacks of paper. Things can get lost. Once they were turned in, the quality department would have to hand key that data into Excel and then manually calculate the compliance percentage. And so just that right there leaves room for error. And the directors never viewed these forms. They only viewed the data after quality calculated the scores. And so now with this new process, the initiator, the nurse, sends it to the director for signature approval. And you weren't really sure if they were completed on time because even if someone writes a date and time on there, it's not like a timestamp from a computer. And so with the new process with FastFlow, we actually had to update some questions and some choices for answers, and we were able to just push it out on FastFlow, and no one has access to the older version. The date of initiation is locked down, so I'm going to show you that real quick. So this date right here, that determines which week it's counted for, and it's auto-populated, and you can't even modify it if you wanted to. The next two items on the bullet points were that they're required. Everything on this form is required except for other participants. So we don't have the issue of a question not being answered because you can't submit the form until all of the required fields are answered. And then, as you can see, right for question 1 and 2, we have the options of yes and no. But for question 3, we have yes, no, and NA. And so they are not able, like for the yes and no question, they're not able to put NA because we locked down the field in terms of what answers could be provided. And then what we did was we added like about 100 or so hidden fields right here on the right side. So every time you click yes, no, and you're answering these questions, this compliance is calculating as you answer the question. So by the time the nurse is finishes answering the 56 questions, he or she knows the compliance for that patient, and then the director also knows when they get the form what the compliance was. Let's see. And so, yeah, it must be signed by the director, so the directors get to see the data. And the directors wouldn't be able to change the data. Like, let's say they knew, oh, this isn't correct. They can't change the data. It would have to go back to the nurse, so it had that level of security on there. And then we created a report, so instead of quality hand-typing all this data into Excel and then reporting off of it, they can just go into FastFlow and pick the date range, and even by nursing unit if they want to, and then they have an Excel sheet with all the data. And then, oh, and this is just we just wanted to put this in there because we do a Visio flowchart for all of our forms and workflows. It just helps everyone get on the same page, and we put a lot of information on there, like the reporting week starts Monday and ends Sunday. If you don't have a FastFlow icon on your desktop, you can put in a help desk ticket. So one of these always just helps everyone, especially the directors, get on the same page. And the last form I want to go over is the monthly mileage return. This is just for employee travel for normal business that need to get reimbursed for their mileage. The old process, there was no version control. There was copies of old forms with old rates from years and years ago just laying around that people continue to make copies of. There was a manual calculation, so when you fill out the form, they would add up all their miles themselves, and payroll would have to confirm it themselves. And then a manual feedback loop. So let's say someone forgot to sign something or something wasn't correct on the form, they would have to inter-office that form back or fax it back to them. Whereas with FastFlow, we can just reject and add a comment. So with FastFlow, we do have version control. Every January, payroll sends us an email to update the new mileage rate if there is one. It auto-calculates and it locks down certain fields, which I'll show you on the next page. And then just the date and time stamps for just in case we have any audits. So as you can see, the first line is all required because we want the employee to fill out at least everything on the first row. When you add the starting and ending mileage that you traveled, it'll automatically calculate the mileage claim for each row. And these are all locked down so they can't type anything in those fields. And it also takes the total over here and multiplies it by the rate to give your reimbursement. And so with FastFlow, one of the things that really helped with the success of certain forms that we have is that payroll and HR, they stopped accepting paper copies of these forms. So when we had our transition where we accepted both paper and electronic forms, we still got quite a bit of both. But then now with, since they only accept this monthly mileage return on FastFlow, it's become a much better process for them. They can run reports to see if they need to see how many they did that pay period and then enter them into another system. And then they also have PDF copies in on their network share folder instead of having a cabinet full of these. So it's a much better process for them. And that's pretty much all I had. If there's any questions, I'm more than happy to answer them. And if anyone wants to see any of our forms or workflows after this conference, you can reach out to Aaron or anyone at FormFast and we can get in touch.
Very good. Thanks, Maneet.
Mm-hmm.
Like Maneet said, we're going to open it up for questions at this time, especially if you aren't using FastFlow yet or and considering using that product. It'd be a great time to ask some questions of Maneet. One question that comes to mind for me, Maneet, is can you speak to the learning curve of going from designing forms for print versus workflow? Because I think one of the unique things about FormFast is that we have one design tool for both print automation and workflow automation. Can you speak to using that tool and learning curve to adapt those forms for FastFlow?
Actually, I wasn't involved with the form imprint implementation. We have two people in our print shop that designed all of those forms, and they designed one of the forms for FastFlow, or actually a couple of the forms, the PAFs and the item table form, and then I designed the rest of them, and they were able to pick up on it just like without much training. We had some training on site, and it's very straightforward. You design the form, you add your fields, and you save it as a PDF, and then you do your testing, and then you might see that you want to change a field to only allow currency in that field or limit fields. But for me, especially for never designing forms before and using the form designer, it was a straightforward process, and you learn little tricks as you go.
Sure. And as any form designers out there might know, when you scan in that document to make it into an OFM, it actually fills in those fillable fields automatically, so that's already prepping it for FastFlow. So I think it's a unique feature of Form Designer. I have a question in here from Allison, who wants to know what structure did you use to set up that many users for FastFlow?
Kendra, she's also another project manager in our department. She handles all the users. I do the forms and the workflows. But I do know let me think about this. We did an initial import with an Excel file, I believe. But I know that now we have an LDAP connection to where she does a test import, and she sees, she makes sure that I don't know exactly what she does, but I do know that she does do it through the LDAP connection, and she just has to verify a couple things, and then it imports. So she waits until IT adds the department and all the information in Active Directory, and then imports it in. And I think for the department changes, I'm not sure if she imports in those or does them manually, but I do know that we are using that LDAP import. And if you need more information than that, I can ask her exactly what she does.
Certainly, and like Maneet said, if you would like to reach out to the team at Right Out Health, feel free to send me an email, and my email is avot@formfast.com, and I'll make sure to pass that request along to connect people. Yeah. And it looks like we do have some requests coming in on the chat for some people to meet you, Maneet. So that's great.
Yeah, and one other thing I wanted to point out too is that we're testing this feature right now for Windows authentication. We have it in our test system to where whoever's logged into the Windows machine, it'll automatically log them into FastFlow. And so we're just playing around with that idea. We have it working in test, but we're just trying to figure out our plan to roll that out. So that makes it allows a user not to have to remember another password since it's tied to their Active Directory login. But yeah, I can put a copy of all of our forms together and send it to you, so you can send it to anyone who wants to see them. And if anyone has any certain questions on any of those forms or workflows, then we're more than happy to talk to them.
Perfect. And that looks like that is all the questions for now. I want to thank Emma Brunick and Manit Bjor for taking the time to present today. We know that you guys are very busy, so we appreciate your time and sharing your experiences.
Thanks.
If you'd like to have your organization featured in a future FormFast event, we'd love to hear from you. Please send me a chat or an email at the email address I just mentioned, avot@formfast.com, and we'll contact you offline to discuss having you featured as well. At this time, we'll be moving to the virtual breakout session of today's event. Momentarily, we'll close the main event. You'll be presented with a selection screen to choose which breakout session to join. Today you have two options. I'll be hosting a tour of our new user group site and showing some features that you'll find helpful as a FormFast user. The other breakout is an ISIS, Interactive Solution Improvement Session. We want your feedback on ways to make our solutions better as we look ahead to future development. An interface will look something like this. So simply click on one of the buttons to be redirected to the breakout session. In order to be mindful of your time, the sessions may be shorter than the hour we've allotted. However, we want to accommodate as many questions as you have, so feel free to share your comments or inquiries with the host. Don't forget to join us again for day 2 of the FormFast user group meeting at the same time, 11 to 2 Central Time. We'll be featuring more user success strategies, group discussion, education, and more. If you haven't registered for day 2 yet, you can still do so at www.formfast.com/UGM. Also, if there's a solution that you'd like to learn more about, we'd be happy to schedule a demonstration for you. Request a demo at formfast.com/contact. But finally, before we move to the breakout session, I can't forget about the iPad mini drawing. From those that registered for day 1, we did a random drawing of those names, and the winner of today's iPad mini is Beth Kay from Mid-Michigan Hospital. So congratulations to Beth. We'll see you tomorrow at the same time for day 2 of the FormFast user group meeting. Enjoy the breakout sessions.